Hi, I'm Dr. David Hill, and today we're going to be talking about asthma in babies. Now, when I think about babies, I'm really thinking about infants, right from birth to age 12 months of age. And these babies can get wheezing diseases. Whether that wheezing disease is really asthma or it's due to an infection can sometimes be very, very unclear. It can be very difficult to make a real diagnosis of asthma in an infant unless that infant gets repeated episodes of wheezing over and over again. So let's talk first of all about what is wheezing. People have a lot of different ideas about what a wheeze is. The wheeze is really the sound of air rushing at an increased velocity through thousands of narrowed airways in the lungs. Baby's trying to get the air out of the lungs, and the airways are narrowed, and it makes this whistling sound that, collected over the thousands of airways that are there, sounds kind of like a high-pitched calliope. It's a sound that babies make breathing out, not breathing in, and it can be a very difficult sound to hear without a stethoscope. So if you can hear the wheeze to the naked ear, that's useful, but often I don't know that a baby's wheezing until I'm actually listening. So what can you see? What can you hear? Well, one thing you can look for is a chronic cough. That can be a sign of asthma, especially a cough that goes on more than 3 weeks or that seems to be predominant during the nighttime. The things that really worry me are increased respiratory rate. An infant who's breathing more than about 40 times a minute on average is by definition abnormal. And if that infant is breathing more than 60 times a minute, he or she may have a really tough time feeding and staying hydrated. So if your infant is breathing more than once a second over a whole minute, you really want to seek care immediately and figure out if that infant needs to be hospitalized, needs a breathing treatment, or what. That's not the way they're supposed to be breathing. Other things you want to look for are the skin pulling up under the rib cage or between the ribs or at the base of the throat. That's a sign of respiratory distress. Likewise, if you see your baby using his or her abdominal muscles, it looks like they're maybe doing some kind of core workout. That's not right. That's respiratory distress. Those things all bother me. What else? You can look at the nose if it's flaring with every breath, or if you hear the baby grunting, making a little with every breath. Those are all signs of respiratory distress. It could be asthma, it could be an infection, but whatever it is, it needs to be treated immediately. Now, if your baby is already being treated for wheezing with albuterol, as a general rule, if you have to use it for more than 24 hours, you need to be evaluated. Certainly if the baby's doing better or worse, that baby needs to be evaluated. Doctors will often use steroids to treat what we think is asthma in babies. That tends to help, unless we know that the baby has an infection like RSV, and in those cases, steroids are not always helpful. So, figuring out asthma in babies requires a stethoscope. It requires a doctor with a lot of experience treating babies, and often it requires a lot of time and attention. Most importantly, if your baby's having breathing trouble, for gosh sake, get him or her seen quickly by a medical professional. Talking about asthma in babies, I'm Dr. David Hill.